At Northeast Texas. Band, I went to Bandera.
All right, it's 10 o'clock. If you'll rise and join in the Pledge of Allegiance, we'll call the meeting to order.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Is there anybody from the public who would like to speak at the public forum? Come on forward.
Good afternoon, Denise Weiss, Graston. I've been up here several times. I believe I've been very accommodating as far as being respectful for what data that we turn in, and also being respectful for our limited in time. Now, we've gone to the zoning and we have found that the subcommittee has gone on a field trip with unlimited access to the drug dealers. And we also know that the board has gone on field trips to Onamia. And I am asking why, when we have asked for our representatives who are non-biased, who are engineers in the firm for several other states who build these greenhouses, both vegetables and cannabis, why we have not had the same reaction that you guys want to hear that side of the conversation. Feels like it is a one-sided conversation, and that is unfair, and that is unfair to the public who pays everybody's wages and for the lights to be on. We have given things that have stated these are federally illegal, and I'm sorry, we don't hear much of anything saying, yes, we agree with you. This is federally illegal. We do need to protect the community first. And it is very frustrating. And it is wrong. And I want to know the minutes for this field trip that happened in October, because when we tried to raise our hand and say, no, this is incorrect information, we were told we couldn't talk. We were told we couldn't speak. So how is this a one-sided thing? That Mr. Zappa can talk about all of this stuff, doesn't have to get to the podium, isn't required to have his 3-minute stay, and we are. That is wrong. This product will do nothing but destroy our social fabric of our community and suck the resources out of our county. We have asked just for protection and to have these located in areas that will protect the community while allowing a federally illegal drug to be raised in our county. I would like to know where we can get the minutes for this unencumbered time so that we can have the same amount of time. And we will bring our expert in, we will bring him into this hall, and everyone is welcome to listen, not just this few secret little society of a field trip. That is very hurtful. No one stopped at our house on the way past. No one asked us about this. We find out about it after the draft has been asked to go back a second time when they don't really have an idea of what is wanted or needed. I'm sorry, but I am upset, and I want to be respectful, and I want to trust every single member up here that they have our interest at heart first and foremost.
Thank you.
Thanks.
Thank you.
Is there anybody else who would like to speak at public forum? No? Okay. We will move on to adopt the agenda. Are there any, we have some additions.
Madam Chair, members of the board, we have additional information for regular agenda item number 1, the Personnel Committee minutes. We have additional information for regular agenda item number 2, the Essentia ambulance report. Then we have a new item, if it could be item 5.1, that is the Nemadji watershed-based implementation budget. And if we could have an additional regular agenda item 5.2, that's a joint powers agreement with Hennepin County for boarding Hennepin County inmates.
Are there any other additions or corrections, revisions? We have a motion to accept the agenda.
I'll move. I'll second.
Is that you, Matt? Okay,
Yeah.
so we have a motion by Steve, a second by Matt. Once again, any questions? All those in favor say aye.
Aye.
Opposed? Motion carried. We need to approve the minutes from November 5th and the summary for publication.
I'll move the minutes.
Thanks, Josh.
I'll second.
Thanks, Steve. Motion by Josh, second by Steve. Are there any questions on the minutes or the summary? All those in favor say aye.
Aye.
Opposed? Motion carried. Minutes of the boards, committees, and correspondence. We've got the general election canvassing board minutes. You guys were here for a bit that day.
I'll move those.
Thank you, Matt.
I'll second them.
Thanks, Steve. Motion by Matt, second by Steve. Any questions on that? All those in favor say aye.
Aye.
Opposed? Motion carried. And then we need to approve the consent items. Are there any questions on the consent agenda? We have a motion to accept it.
I'll move the consent agenda.
Thanks, Josh.
I'll second.
Thanks, Steve. Motion by Josh, second by Steve. Once again, are there any questions on the consent agenda? All those in favor say aye.
Aye.
Opposed? Motion carried. Personnel Committee report.
I'll take that, Madam Chair,
Thank you, Matt.
and I'll share with Steve. He'll cover part of it too. We met yesterday. We acknowledged the resignation of property appraiser Reed White effective October 16th, 2024, and approved the backfill of that position and any subsequent vacancies that may occur due to internal promotion or lateral transfers. Authorized an auditor treasurer, we authorized the hiring of 2 additional transfer station attendants to cover the open shifts and to provide additional assistance during peak times. The petitions, those positions are part-time, non-union grade 1 positions at $17 an hour. And it can be handled in the budget. Sheriff's Office and Jail, we acknowledge the resignation of Corrections Officer Jacqueline Martini effective October 22nd. Approve the backfill of that position and any subsequent vacancies that may occur due to internal promotion or lateral transfer. We acknowledge the resignation of Jail Sergeant Jennifer McQuitty Johnson effective February 14th, 2024. That position has been backfilled. Approve the regrade of jail administrative position, assistant position from a grade 6 to a grade 8. And retitle the position as office manager to reflect increase in job complexity and responsibility. That position was run through our employee, the state,
study.
yeah, and it came out no problem. Approved the updated sheriff's office jail office manager job description. You want me to keep going or, yeah, I'll just keep. And the sheriff's office dispatch, we acknowledge the resignation of part-time dispatcher Janelle Jacobson effective October 28th, 2024, and approve the backfill of that position and any subsequent vacancies that may occur due to internal promotion or lateral transfer. In Health and Human Services, we acknowledge the resignation of eligibility worker Janelle Steinbach effective October 31st, 2024, and approve the backfill of that position and any subsequent vacancies that may occur due to internal promotion or lateral transfer. With that, I will move those, Madam Chair.
Thank you, Matt. We have a second.
I'll second.
Thanks, Josh. Got a motion by Matt, second by Josh. Are there any questions on the Personnel Committee report?
Yeah, I got a few questions.
Go ahead, JJ.
The regrading. Like when you do regrading, on this regrading, who requested the regrading? I mean, it could be an employee or it was supervisor.
Yeah, Madam Chair, Commissioner Wilhelm, our policy allows that a regrade can be requested either by the supervisor or by the employee. And in this case, it was requested by the jail administrator as part of evaluating the vacancy in the assistant jail administrator position and as a way to realign duties and make that office more efficient.
Okay, when I was reading up on it, so you have to do the position description questionnaire first, right? I guess I don't have that in my packet. So what's changed?
Yeah, Jackie, do you want to talk about the changes?
Madam Chair, members of the board, yes, it is the procedure that the position evaluation form be completed. And that process was done. Rodney Williamson, the jail administrator, completed the analysis, and then the two of us reviewed it together. And we just typically, it's not typically something we've included with the board packet.
Okay, yeah, I guess I'd like to see it
Sure.
at some point. So is it going to be, it's a new position from what I understand, reading this?
No, we regraded and retitled the jail administrative assistant position. The position has grown exponentially. And as mentioned previously, with the vacancy in the assistant jail administrator position, the admin assistant was already, some of the duties had been shifted over, and it will allow the assistant jail administrator to take on more duties in the jail, shifting away more of that administrative role, freeing up time for them to be doing the essential functions of their job.
So how many support staff, I mean, was there and now is there? So
In the jail.
yeah,
And Rodney, please correct me if I'm wrong. There is a jail secretary and a jail administrative assistant, so 2 support staff.
so 2.
Mhm.
Okay.
And that number didn't change.
That number did not change. The head count did not increase.
Okay. Is this, would this be something that, I mean, just trying to piece it together here, why wouldn't this be something that like would be posted for more people to have an opportunity? And then, and also to, to try to follow veterans' preference, if there was anybody,
Yeah, well,
a veteran that might,
well, because we did not add a new position, we took the existing position and we acknowledged the added responsibilities, maybe added a few more and regraded and retitled. It wasn't a new vacancy.
did I miss the job description here then?
Yeah, the job description should be in the additional information packet.
That we just got today,
Well,
It was
the,
emailed yesterday.
emailed yesterday. Gotcha. Okay.
and the personnel committee met yesterday. So
Okay.
due to having to change due to the Veterans Day holiday, it's a little compressed. But it's the last document in the personnel committee portion of the additions.
Josh?
I'd just like to say that this, well, first I'd like to say is thank you, Steve, for covering for me because I had another doctor's appointment come up, but and personnel is, I do usually take it quite to heart. It is a good committee. We do a lot of good work. This is not uncommon. We do this quite often. A lot of times when there is a change in the position, that's a time where we'll take a step back, maybe look at it. Maybe there's something that supervisor was like, you know what, the last person we didn't have doing this, this is something we really want to do with this next one. So we do regrade job description quite often. I mean, it does come through this, I don't know exactly how often, but it seems like it does happen quite a bit. So this is nothing new as far as that goes, so.
And there have been occasions where a regrade has been requested and we've reviewed the position using the analysis and the Springstead grading, and we have not increased the grade. Maybe we've added more points, maybe we haven't, but we've not always had
How
a
many,
grade change.
how many years does the candidate have for the regrade? How many years' experience in the county? Curious.
I think the candidate is just coming up on their 1-year anniversary. Oh, I'm sorry. Oh, 2-year. Time flies.
Okay, yeah, I didn't notice this because usually it's highlighted in red, all the changes.
That's a
and doesn't.
good observation. And why it's not is because there were too many changes. It got really confusing. We really revamped. We didn't just add a few things. We really just revised the entire description. But I'm happy to provide a copy of the old.
Yeah, I
description
guess
you'd
if
like
it
that.
was just to save on red ink, I would have liked to see then
Sure.
the old one to compare.
Any more questions?
No, that should do it for me.
Okay, we have a motion by Matt, a second by Josh. All those in favor say aye.
Alright.
Opposed?
I oppose.
And then there's more to the report too, so Steve will take that.
Go ahead.
We also heard a presentation from a committee that has been working on employee recognition. And this will be rolled out to the employees during our the wellness. When is that, Jackie? The wellness? December 5th. And the first phase of it, help me if I'm wrong, Jackie, but is that anybody that recognizes somebody that's kind of gone above and beyond is welcome to send an email copy to the supervisor. And not to recognize yourself for what a great job you did, but somebody else who has stepped forward and done something kind of extraordinary or above and beyond what would be in the scope of their regular duties.
Nice.
Madam Chair,
Yes.
can I just go back one little bit? So JJ, you oppose people resigning and taking different jobs? That's what you're.
If you wanna change the motion and do it one by one, that would be
something
okay
you
for
could
me.
do as you're in there, but I just wanted to be clear, so
Want to rescind the motion and go one
we
by
already
one?
voted on it. I'm just clarifying.
So you're asking him what it was that he voted no for?
Well, he voted no against everything. So he doesn't want this dispatcher to resign or this Health and Human Services Director or service person or any of that, so.
You can separate them all next time.
Okay, that's where the discussion comes in when we made the motions, but all right.
Okay, moving on to Essentia.
Righty.
Welcome.
Yes, welcome. everybody.
Hi.
Thanks for having me.
Thank you for coming.
Yes, thank you very much. Sorry I couldn't come earlier in the year, to be honest, so. So I have our annual report for you guys, a little bit shorter than normal. I did try to include some items from last year's. That I had written down of things you had questions on to hopefully highlight a little better and add some clarity to some if possible. Okay. So Essentia EMS, we have two medical directors. They are both physicians. One's based out of Fargo. He's our chief medical director. Our associate medical director is Brandon Drazich. He's also an EMS physician. He actually works frequently down in the Sandstone and Moose Lake EDs. So our crews are seeing him. We have 7 ambulance locations right now with 9 bases, 4 of those being based here locally. We have about 150 EMS clinicians. We have 6 current community paramedic locations throughout Minnesota. The closest one to here would be Duluth. We do about approximately 13,000 responses a year. We have a full-time mechanic. You probably see him driving around up and down the interstate in his mechanic tool truck a lot. He lives just south of Pine County, so he comes through every day when he's going anywhere. I guess one change for us this last year, we did make the decision that any of our operational leaders, so a team lead, supervisor, manager, director, we do require them to be a paramedic. We always have technically, but we updated our descriptions to make that noted now. We have a centralized billing office. Technically, it's based out of Duluth, although those billers work remotely. We have an interfacility dispatch center that we opened up a couple of years ago, but we just did a massive remodel in the last 12 months. So that's functioning now up in Duluth. And then we're currently operating about 23 physical ambulances throughout Minnesota. So locally here, we have our I-35 operations. Last year we did 5,700 responses. That number is going to look higher than years past because we're including our Moose Lake operation with that. We operate as one singular unit where we can now. So we have 4 base locations. Those are physical base locations that people show up to work every day. Moose Lake, Sandstone, Hinckley, and Pine City. That area does include 4 counties. The vast majority is almost all of Pine County. And then about the southern half to a third of Carleton County and a little bit of Aiken and the east side of Kanabec County. So we do have the casino inside that area, 5 correctional facilities. We have the tribal reservation, multiple state forests. All in total, it's about 70 miles of I-35 and approximately 1,900 square miles of coverage that we're doing here. So what we made in the last year, we have combined our Sandstone and Moose Lake operations and our leadership team. We were slowly working this process since Moose Lake's come on board with being Essentia since 2020. And we've kind of made a big step up this last year. The big one would being is that operational flow of staff. So we can share resources and then having one leadership team instead of two separate ones. With locally, the big change though is we made Hinckley from an 18 hours a day. We were there from 7 a.m. to 1 a.m. before. We're there 24/7 now. And then in Sandstone, we added an additional crew. So we have two staff crews there. One starts at 5 a.m., goes to 11 p.m. The other one comes on at 11 a.m. and goes to 5 a.m. With that leadership change, we changed to one regional manager position instead of two separate supervisors, but we did also add 3 team lead positions. Those are all paramedics. They traditionally were all field training officers for us in the past. They all came internally. We are currently doing a trial run of we call it our 310 project. So if you ever see an Essentia Health Jeep driving around with lights and sirens on, those are our team leads going to calls. And they are daily operation leaders. So instead of just having one of us being at home trying to, organize this giant project every day, one of them is pretty much here all the time. So it has that fluidity, that's a word, to the operation. We did create a full-time education. We call it our clinical excellence department. So one of our supervisors is very large into education. So that's a full-time position now. His sole focus is clinical excellence of our staff and also education of our staff. We did make some changes. The big one that we rolled out this late summer was Suboxone, which shouldn't be confused with naloxone or Narcan. It's used post-treatment of an overdose. So traditionally when we went to an overdose and gave someone Narcan, the sheriff's office gave Narcan, we would do an assessment on them. A lot of times they wouldn't come with the ambulance and we would generally come back at some point in time for the same problem again. So we give a medication to them. It kind of, the simplistic view of it is it kind of prevents them from getting high for the next 24 hours. They can still get an amount of being high, but they don't get the overdose affecting of it. So with that, once we administer that and they agree to it, we take their information and our substance abuse counselors, more or less, reach out to them and we try to get them to some sort of program. If we can get them to show up to like 2 visits within the first month, we can decrease mortality by almost 40% in the county. So that was a few years ago. It's definitely less in the last couple of years, but 2 years ago, if you asked me, that was one of our number one, I'd say, killers of residents.
Is that something that you think is going to become more popular like naloxone did?
I hope Suboxone does. There's a lot of challenges organizations have to go through to get it. Mainly being it's considered a controlled substance with the DEA. So you still have to purchase it with the DEA order. We sought for probably 18 months to get clarity by the Board of Pharmacy if paramedics were allowed to administer it, and where paramedics lie. So there was a lot of legal clarification we had to find. And then the big word is we can't consider dispensing a controlled substance. Some states that are doing this leave behind extra for the next day. That's considered dispensing and we're not a pharmacy. So that's why we're allowed to administer it, but we can't currently at today's date. Our legal team is saying we can't leave it behind extra. Currently in Minnesota, there's 9 ambulance services doing it. Essentia has 7 of those 9. Whiter Tribal Reservation and Bemidji Ambulance are the other 2. So I hope it becomes a big thing. Hennepin County uses it with a similar guideline. We just lessened ours. We brought it in kind of like if someone overdoses and if they have a really high score that they're going to go through withdrawals, then we'll administer it. We just lessened that threshold last week by about 60%. So now they don't have to get Narcan to get it even, just having withdrawals is enough reason. So we're hoping to use it. We got a grant for it. We have a lot of doses of it, so I'd like to use it.
Have you, yes,
Mhm,
have you done it long enough so you can see any trend line stuff that?
We didn't launch it until would have been the end of August, early September. And we haven't had we had about 7 to 8 opportunities to use it that our original guideline prevented us from. So that was why we updated it, as we were finding this barrier to care. So instead of just holding that line, we decided to change that barrier and see if we can make a difference there. So I'm hoping in the year I have a better answer on that one.
Interesting to follow that.
Huh?
It'll be interesting to follow that.
That is, I think, going to be one of the bigger projects we've done as an ambulance service is what good can we do from this? And hopefully there's no harm from it. It's got less of a chance of harming someone than giving someone aspirin with chest pain. So the other big one we've done, this is a trial still. We're now in phase 2 of our trial is we use nebulized ketamine. We use this for pain management. So instead of giving traditional opiates like fentanyl for pain management, we've taken our team leads and our field training officers And we gave them extra training on how to administer ketamine nebulized. They've always been able to administer IV or in their muscle. But now we put it in a little nebulizer, and the patient can actually just breathe it in. And if they get too much, it just falls out of their mouth. We've had amazing results from it. I believe we're the only ambulance in Minnesota using that. We just made a change in our guideline. We were finding we had to give people 2 doses of it to get therapeutic effects, so we doubled our dose. But this was about a month ago. We had about 40 administrations. We had 0 negative reactions to patients. And we had about 3-4 people didn't have any effect, but the rest of them all had some positive effect. So we can decrease our use of opioids, and it decreases the amount of needles that are open in the truck to treat pain.
Nice.
So that one will be probably rolled out by the end of this calendar year, system-wide for all our staff, but we have 7 of our paramedics locally doing that. We also continue to advance our STEMI program, which is our heart attack, so administering heparin and Brilinta. Those are the 2 medications that were kind of key to get people to a critical access or a small community hospital before they went to a big one. So we just took that barrier out and just started adding those medications in our trucks, which is why you'll see our crews driving, especially like in this area, straight to Duluth or straight down to St. Paul with someone having a heart attack. Our stroke, we've become the model guideline for other organizations across Minnesota and also across the Midwest, with how we're going about our stroke care. We also had nicardipine. It's normally only seen in a large trauma center, or not trauma center, stroke center for treating those stroke patients. It allows us to safely bring your blood pressure down instead of just drastically dropping it. So other changes we made, we purchased 2 new ambulances in the area here. We're hoping to add 3 more this calendar year, or this coming calendar year as well. So the back order on them has kind of lessened, and we've also found a new avenue of having a good supply of ambulances. Last week, we launched a new AVL system, which is our automatic vehicle locator. So it tracks our trucks. So we have our CAD units that track our trucks, but this is a separate unit. This allows our crews to do their rig checks, see where the trucks are, and then the big one is it has dash cameras, and it uses AI to how safe our staff are driving. And it gives them instant feedback. So it'll tell them, put your seatbelt on, slow down, distracted driving, which is actually, we went into this thinking distracted driving wasn't going to be an issue. And we found that a lot of our staff, our CADs, have a delay going through the internet for routing. So they're using their personal cell phones for GPS. We didn't supply them anywhere to put that phone. So we've upgraded all our trucks now so they have phone holders in them so they can lock their phone in the corner of the screen.
Does our dispatch see that?
They don't currently, because we just launched our AVL side of it. And the AVL side just shows a bumper number and it shows every unit in our system. So like it'll show, like right now, Pine City, it'll show 2 trucks here, even though 1's staffed. Our old system, though, they did have access to. We are planning on pushing that out. It's just going through the permission levels. This one, our old one was pretty simplistic, and this one's got hundreds upon hundreds of different security groups. So just trying to go in through and make sure we're not giving out any extra info we need to. The nice thing is they do have dash cameras. They face out and in, and they record. So I actually get an email anytime we have a harsh safety event, or if we have some sort of crash. Deer strikes are normally what causes the crash alert.
I was talking about the advanced vehicle location. Does our dispatch see that?
So our old system they did, the new one we haven't given access to because we just launched it. But they have access to our CAD screens already, which shows what units are available, which ones they can see then. So we do share that info. It's just the other side because what we use for a call sign and talk to them isn't what the back of the truck says. So it does get pretty confusing rather quickly. We use it mainly to review driver history, see if they were speeding here. We get complaints on a frequent basis throughout every ambulance about your ambulance is going 110 miles an hour. And when you try and sit down with someone, explain not, you can just pull up the video. Our trucks are governed to 84, so it's not even possible. So it's nice to have that clarity though. And we have that in all our supervisor vehicles, and we also have that in all our community paramedic vehicles. So if it has wheels on it, we have that system in it now. We did add 5 Hamilton ventilators. These are the same ventilators that every air service are using. They're phenomenal. They're lifesavers. They make being a paramedic significantly easier too. And it's a higher chance of survival by using them. So we did get 3 of those from the North Pine Area Hospital District, and 2 of them from the Moose Lake Foundation. We did institute Hand Heavy, which is a pediatric app initially, and now it does adult dosing. So we've taken it. So if I needed to give you so much of a milligram of medication, we always expected paramedics to be able to figure out that math as to how much volume in a syringe. This does that math for them. So it cuts down our chance of an error, and it makes those pediatric cardiac arrest and critical pediatric calls significantly safer for our staff and more comfortable going into it. We did overhaul our onboarding process. So we now do an academy. The first week of it, they spend in Moose Lake or Detroit Lakes. And that's with our clinical excellence team. They go through every piece of equipment, every single software we use. And then we have a 5-stage onboarding process there. So it's very systematic. It has some ability to be flexible for people that come in with experience versus no experience, but it does allow us to have a systemized standard that's pretty nationally accepted by most organizations. We did become a full participant on Armor. That was one of our bigger expenses for the year. So now we have the same ability with the radio system in Minnesota as any other county or sheriff's office has. So that allows us to kind of keep advancing and keep trying to keep our staff safer. We currently are in the process. We were approved to replace all our cardiac monitors and add cardiac monitors to our SUVs. Currently we have AEDs in our SUVs. So that was for both MSRP is 46,000. We got approved for 8 of those locally. So those are currently on order and waiting for arrival.
Ryan, can you click in? Thank you.
Oh, it got switched off.
Oh.
That'll do it. Our daily staffing, so from 11 a.m. to 11 p.m. with full staffing, we have 5 trucks on, 1 in Pine City, 1 in Hinckley, 2 in Sandstone, 1 in Moose Lake. And then on the overnight hours till 11 a.m., we have 1 crew in Sandstone then versus 2. We do have the ability to add an extra ALS or BLS ambulance for events. And then we also have all our SUVs are equipped as an ALS quick response vehicle. So today we actually have one of them on the road due to a sick call. We do a dynamic deployment plan. This is the part last year I think people had questions on that I wanted to make sure we added in. So we have 6 levels to it. Level 0 means all our trucks are on calls. Level 1 means we have 1 truck available and so on. We do a point grading system. I get asked a lot why Moose Lake and Pine City have a value of 2 versus all the other ones have a value of 1. That's because the service line technically has the value of 1. So we just put it there to make it easier for crew to see. So if we have more than 2 trucks or more available, we have to have 1 in the blue group on top and 1 in the green group. And then if we have 3, then we have to have 2 in the green, 1 in the blue, and then just so on. So all that looks is if we have 1 truck available, this gets us there due to 911 calls. We'll have our last truck move to the Banning exit. If we have 2 trucks available, if it's going to be a long-term thing, or if we can make it happen easily, we'll have a truck in Moose Lake and a truck in Hinckley. If it's a short-term thing due to a crew just going on 911 call quick, we'll put a crew in Willow River and a crew in Pine City. That happens when the Pine City crew is the last crew available in Pine County. Our Moose Lake truck will move to Willow, or our Sandstone crew move up to Willow. When I say preferred here, this doesn't mean we prefer to only have 3 trucks available. This is if we're at level 3. This is how we prefer to lay them out then. So we have a crew in Pine City, Sandstone, and Moose Lake. Other deployment plans are next to it. So we could do Pine City, Hinckley, and Willow River. We could do Pine City, Hinckley, and Moose Lake. There's a lot of different options when you get to 3. But when we have 3 for a longer extended period of time, we try to spread those resources as equally as we can. When we have 4 trucks available, it's all 4 of our home bases. And when we have 5, the extra truck sits in Sandstone. We get asked about transfers. We don't, when we have level 3 or less, I should say, I'll go back. If we have one or 2 trucks around, we're not doing a transfer. If we have 3 trucks around, we'll do a local transfer. So if that's someone getting discharged from one of our EDs back to a nursing home in town, or someone going from Sandstone Hospital to Duluth, Moose Lake to Duluth. Once we get to 4 or 5, those are more of our system-wide resources. We justify those expenses here to be able to offset by taking a transfer out of Duluth or grabbing someone from our facility. So our biggest thing that we're working on right now as an industry is our workforce. Our workforce is decreasing. This graph up here shows under 30 for expirations is one of the bigger losers. So 46% of people that were certified under 30 leave the field. 66% under 40 leave the field. That's our bread and butter staff that we want to keep staying around. And this isn't Essentia. This is a statewide average. And then we look at people that appear on patient care reports. So this is a 180-day average across the state. Only 42% of certified EMTs showed up on an ambulance report. So about 58% aren't working on an ambulance that are out there. And some of these are expected positions. So example, our dispatchers are all required to be an EMT. They don't go on ambulance calls. So there is some there. Fire departments a lot of times required to be an EMT. Some police departments do. So they're not going to be on an ambulance report. So that's why you can have some of those numbers. Also ER techs a lot of times are EMTs. But there is a large, I mean, there's over half the current workforce out there certified that we just can't tap into currently. Paramedics, about 80% haven't appeared or have appeared. So 20% haven't. Urgency centers and urgent cares have been hiring paramedics frequently now. So that's been one of our losers. And then also just paramedics going on to nursing. It's another one of our workforce losses. In 2019 was the last year in Minnesota that there was more people certified than people that expired, though. So if you look at the very bottom graph there, the green is how many people came into the field, the red's how many left the field. So every year we're losing more and more workforce, although our need for a workforce is growing every year. So what we've done locally here to mitigate this, we did a fairly good, I think, pay adjustment this last year. So our EMTs got approximately an 18 and 19% pay raise over the last year. Our paramedics got about 21 to 22%. The full-time numbers there, that's based off of 1.05 FTE for us. That put us more on par with, I would say, the Twin Cities market. It's still a little bit less, but it's significantly increased. That's helped dramatically with ours. Our cost to our organization for doing that, though, is about 900,000 to do that. We've continued to support EMTs going to paramedic school. That has been our largest recruitment. We do, I think every ambulance in Minnesota struggles to recruit paramedics, but we've done very well doing internal recruitment because of it. We're now launching a EMT to community paramedic program that we're working with Minnesota North College on. So that we've found that we can't find community paramedics for community paramedic locations, so taking our medics into making community paramedics. We also do a critical needs incentives. So if we have a short call shift where we're at minimum staffing, we give up to a $360 bonus for the day. And they're still eligible for overtime and any other adjuster they would get that day.
Madam Chair.
Yeah.
Just a real quick question about the staffing and stuff. Is there a path to get into it? Or like if you just say, I want to become a paramedic or part of your ambulance crew, can I get hired on today, be a quote driver or something like that and not have?
So we don't hire Minnesota has a driver statute. We don't hire a driver because of how our licensed areas. So example, in Pine County, our licensed base is Sandstone and all the other ones are substations. By statute, the first truck out the door can't have that vehicle staffed that way.
Yep.
Which would mean if I had a driver on in Pine City and there was a 911 call in Pine City, by statute, I'd have to have the Sandstone ambulance respond before the Pine City truck could go in or out. So it's not a logistical thing that works for us here well. There is some ways to do it, but we've done fairly well. I'll have the little thing about staffing at the end. When I was on my phone earlier, that was actually finishing up filling one of our positions. So we've done really well late summer into this fall since our pay adjustment. We've recruited a lot of staff. I think we're gonna be at 16, 17 new full-time employees in the last handful of months. So
Very nice.
Has the college locally been helping?
we get
people
some.
started?
We have I think 4 students from Pine Tech right now writing, 3 or 4 writing from Pine Tech. We've also there's a few colleges in Minnesota now that have started sending us a lot of their paramedic students as well. Because it's a rural area, but we have such progressive guidelines that these students want to come right here because they want to, they want that safety net to do as much as they can before they're out on their own. And that gives us, it doesn't cost anything to have them here. And honestly, it's the cheapest recruitment I can ever have.
Mhm. Cool.
Madam Chair, I got a question. Like on Moose Lake, do you guys break it down or you respond to the state facilities there?
Yes.
Correct.
Yes.
A lot of calls up there,
Yes.
or you,
Um,
do you break it down though? How many?
I could if you're interested in it.
I am interested in that. Yeah.
Yes, it is astonishing how we do go to both the facilities in Moose Lake a lot.
Yeah.
And if you compare I was actually working on this recently because I was intrigued. If you compare the population of those 2 facilities versus the population of the federal
town.
facility in Sandstone, they're not comparable at all. We rarely go to the Sandstone Federal Correctional Facility and we go to those 2 facilities on a daily basis, if
Yeah.
not multiple times every day.
Yeah, I would love to have that information. And then also like the city of Hinckley, the casino calls.
Yes, the casino calls do present the challenges due to how many addresses are there. So you have to be takes a little bit of time because it's not one physical address. It's easy to pull a number from.
Sure.
But yes, it's something we can pull together.
Yep. And then thanks for bringing up the Sandstone.
Yeah.
Because that was the
Oh,
3rd question, so.
okay. Yeah, I was gonna say,
Yeah, thank you.
state facilities call the most. Right below it's county facility, and then state or federal is significantly below that.
Yeah.
But counties and state are significantly higher utilizers. At least for us.
Yeah, if you could email that to the board, that would be
Yeah,
great. If you could-
I think I can do that. Can I just send it over to David and
David,
get it out to you guys?
Thank you, sir.
Other workforce things we've done, the state of Minnesota is a $5,000 grant for an EMT who wants to become a paramedic. We also offer $2,500 a year for tuition reimbursement that can be used if they want to go to nursing and they want a bachelor's degree or paramedic school. We do give a $7,500 sign-on bonus to new paramedics that come full-time to our organization or get internally promoted. And then we have our education to employment grants inside, which for us, that means our EMTs that become paramedics, we give them an extra $12,000. They get half of it when they sign up for school and the other half once they complete school. And then the hospital district does have grants. Those vary year to year. And I guess that's their dollar to talk about, but it is pretty significant what they give out. This number here is slightly, it's almost accurate now. It's off by 1 or 2 here and there. Just because we did hire 3 people since when I sent this in. So when we made this though, we had 17 paramedics in our Sandstone location, which would be our Pine County operations. 3 in our Moose Lake operation. So a total of 20. And then we had 24 EMTs, 17 of them based in Pine County, 6 of them based in Moose Lake. We did make a change this last year we haven't officially stopped, but we have stopped the recruitment effort of casual employees and we've switched to hiring almost all full-time employees. They're a lot easier to manage and then it's a lot easier to hold a standard too. When we started this, we had, I think, 25 casual employees. So it made our numbers look really good, but trying to get them to finish education, paying for uniforms, making sure we were doing things appropriately was difficult. So now we're down about 6. It's much more manageable level. We do have 4 open positions, 2 EMTs, 2 paramedics. Both those EMT positions are filled now. And then one of the paramedic positions will be filled this afternoon because the person just passed. It was one of our internal candidates. So we're currently recruiting then for 1 full-time paramedic spot out of our Moose Lake location. And now we'll be adding an EMT spot for our internal promotion down here. Responses by base, we did 4,300 911 calls in our I-35 area, 1,400 interfacility transports. Moose Lake did about 1,500 responses. Sandstone base did 1,400 responses. Hinckley did 1,300 and Pine City did about 1,400. So they're all pretty comparable, I would say. Moose Lake, while sometimes does a little more call volume, a lot of their calls are directly within a 5-mile radius of Moose Lake versus Pine City. You're driving at a minimum 18 miles one direction or 20 miles the other to get someone to a facility. Here's by city. Now this is by name. So this is what pops up as the name on the chart. So some of these can get a little screwed. I'm trying to think. I don't think any of these are. I think we did a pretty good job clearing these up. Pine City was by far our biggest utilizer by a city. So about 1,100 responses, and that's also the zip code of Pine City. We don't break it down to township level. Hinckley is in our Sandstone and Moose Lake, and then so on down Barnum, Sturgeon Lake, Finlayson, Willow River, Ascove.
So you do break it, excuse me, you do break it down. You've got like Maroon and Cloverdale down there, Henriette.
Yes.
Some of those smaller areas are.
So, and it depends how our crews type in the zip code for it, and then it pulls up. So if they're like in the area of Henriette, a lot of times they'll click the Henriette one. But if they're not like immediately in Henriette, the vast majority of them get coded as Pine City. And the only time we change them is if the post office sends back some letter. That's about the only way we have of doing it.
Okay.
So this is the one challenge when we look at call volume and like location name is it comes off as zip code. And you can clarify it by name, but I also know our staff are human too. About 80% of all our responses are in Pine County, 17 in Carlton County, 2% in Kanabec, and about 1% other areas. I do know our Aiken County number is low. We did find an error in our number when we pulled up there that a lot of those addresses out west of Finlayson were getting quoted as a Pine County address versus they're actually in Aiken County. So these are our top 10 dispatch reasons. We do color code these internally because we do want to find a way to do emergency medical dispatching someday to show us how often we're getting to high acuity calls versus low acuity calls. So fall is the most common reason someone calls 911. Followed by just sick person, and then psychiatric problems, breathing problem, chest pain, traffic. Lift assist number is high up there. That was a number that years ago was not even tracked. Most our lift assist and falls are about the same type of call. Just depends on how it's coded that day. And they are probably one of the bigger burdens on our operations. Very few people get transported out of those. Like 80% of those sign on scene. But they take us the most resources. And it's the most common time our crews get hurt on an event. Yes.
How many false calls do you know, my watch goes off if I pound with a hammer, you know, and then it'll say, do you really want to call 911? Well,
I don't have that number. I don't know how that would be tracked. I don't know if the sheriff's office does. Like, I know they track who the caller is. I don't know if there is a sublet line of like the caller type though.
So you guys.
We don't.
You don't have a anecdotal thing. where
No, we
you show
track
up and
automatic
the guy
track
goes, "What are
or
you
automatic
doing
crash
here?"
ones that go off or vehicle crashes, but we don't have a fall one that we do.
Okay.
Especially because a lot of those I feel like would be labeled underneath a medical alert,
Yeah.
welfare check. Like medical alarm is one of our top reasons too.
Yeah.
So I feel like a lot of those could probably fit into there. And it's kind of like, where does it live? And I'm only allowed to report out 36 different reasons for calling. The government only allows us to, it has to fit in one of those 36 somehow, so.
Yeah, I get you.
But then next to it, to your question about jails and prisons, this is how you can kind of separate them out, or how we can, we'll just pull up by zip code then. So homes is the most common place people call us from. Otherwise assisted living centers and nursing homes, which I think is fairly expected. Commercial businesses, our clinic and urgent care numbers percentile are really high in this area compared to other sites we operate. And then our jail percentile is high as well. But that's also because we have multiple correctional facilities compared to most of our sites have one or two maybe. So we transported on 911 responses just under 3,000 patients last year. About 1,300 of them did not get transported. They were either treated on the scene or refused to be transported. We did utilize an air resource 46 times last year. 31 times was with LifeLink, 15 was with AirCare. You'll see on the destination side, you'll notice that the numbers don't line up. Like LifeLink says 31 on my left side, and on the right side says 25. That means 25 times we drove to the helicopter. And 6 times they landed at the actual scene. As soon as the truck goes in drive, we consider it transport. Most common place people get transported to is Sandstone Hospital, followed by Mora or Wellia Health over in Mora, and then Moose Lake. And then Cambridge has still got a good percentile, and Wyoming.
Do you, you've got the ones that you transported, but I've heard that if you don't transport, is it with you guys also that if you do not transport, that you do not get reimbursed?
We do, so we don't get governmentally wise reimbursed for refusal on today's date. We do bill for all our responses. And if they have private insurance, we will attempt to bill their private insurance. Most private insurance is more than willing to pay that bill because they don't have to pay for the whole ambulance trip and the ED visit. The federal government and our government partners have chosen that's not a billable expense to them. So they would rather us transport those people on MA or Medicare to the hospital and then pay for our ambulance trip and then pay for the ED visit and all the labs. That is one thing I'm hoping we can see change the next few years. Because it's about 30% of the time here, it's uncompensated care.
Is there any way that we can help you with that?
There's things we could look at. I don't want to speak to that side of the business model, just because I don't want to misspeak on it.
Okay.
But there is things we could look at doing. This area is actually low on people on Medicare compared to other areas we cover, but it's significantly higher on people that are on medical assistance. I believe it's 28% of the population here that patients that we've billed are on MA, versus a lot of our sites are in the 10-12%. And it's when it comes to MA paying, they don't pay me difference if it's a paramedic or an EMT in the back of the truck then. But yes, a lot of them, we are seeing a lot still wanting to go to other community areas. We don't force anyone to go to one hospital or the next. There is a few caveats to that. If it's a safety situation for a crew, so a blizzard, we'll go to what's called closest hospital or closest safest hospital, which is whatever the closest hospital is the crew can transport to. Also, if someone's having a heart attack and they want to go to a smaller facility in the immediate area, we're going to inform them that we need to go to either one of the 2 hospitals in Duluth or pick and choose which one of the Twin Cities metro you want to go to. Because by us stopping there, we're not doing anything positive for you. Procedure wise, we identified 33 heart attacks with our paramedics and EMTs last year in the field. So these were 33 times we were able to recognize this and bring patients straight to a cath lab and meet a cardiologist. We identified 152 either confirmed or possible strokes inside of our service area here. 134 cases of sepsis, which is the #1 killer of inpatients in the US, I believe. And we provided care to 78 patients in cardiac arrest in the area. The sepsis number here is significantly higher than most organizations, but we also track it and treat it much more aggressively than pretty much anyone. Medication wise, we administered about 4,500 medications to people on 911 calls, about 10,000 procedures, about 1,800 IV starts. When we look at that 33 heart attacks, we had to do 1,512 lead ECGs to find those 33. So it's a very small number that you have to sort through to find them. Our paramedics did 85 advanced airways. That's what we put a breathing tube in. We defibrillated 69 patients last year. We used our BiPAP 55 times, and we also used our ventilators 58 times. Those two numbers will be using our Hamilton vents. So we utilize them on a fairly frequent basis. This is when you look at age. I don't think this is unexpected. The older you get, the more you call an ambulance. So once you hit about mid to upper 50s, the chance of you calling an ambulance goes up until you get the upper 60s, 70s, and it's a lot more. More males than females call. By day of the week. Why that number is, I don't know. And it actually changes depending on which site I'm at. Saturday or Friday and Saturdays are our busiest day, followed by Wednesday. And Thursdays and Tuesdays are our slowest days.
Wednesday is flea market day.
The weekend thing does not surprise me at all. I mean, everyone sees the weekends and find more people are moving around. There's more things going on. People have cabins. And then the Wednesday doesn't surprise me either because of hospital bed placement. Hospitals are full from the weekend. They discharge Monday, Tuesday. Now they're full again by Wednesday. So now people are having to move further. Responses, pretty good, kind of choppy throughout the year. December of last year and July and August were our busiest months. By hour of the day, once the sunlight comes out, people call more. We also, though, just because we added our extra truck at night, we added those hours to our nighttime. Just because most of our staff work 12, 18, well, most work 18 or 24-hour shifts, so they need downtime to sleep. So if we run bare minimum staffing at night, when you figure our staging plan, that percent there on the 1 a.m. to 5 a.m., while it looks low, that means every single time if we ran only 3 trucks, that 2 trucks are moving then because of staging, or 3 trucks are moving. So when you look at that number, then you're actually being utilized more at night. So that was the big reason for adding the more nighttime coverage. So, but definitely when the sun's out, people call a lot more. We did win an award last year for clinical excellence from the state of Minnesota. Both our Sandstone locations, so that would be all 3 bases in Pine County, and our Moose Lake location won this. They use benchmarks. I believe there's 12 or 13 areas, and you have to get most of them above 80% or 90%. So that was pretty awesome to get. That looks at stroke care. How long did our responses take on stroke care? How long did our scene time take? What was some of the outcome? Which doesn't look a lot on outcome, but what did our crew did on scene? Did they identify it early? Did they get blood glucose and a 12 lead? STEMI care, how long did we spend on scene? And stuff like that. Trauma care, how long did we spend there? It gets down to nitty gritty. How many people under 18 that had wheezing lung sounds got a nebulizer treatment? So that was pretty awesome to receive that. And that's what I have. And the rest of the time, if you have any questions.
Anybody have any questions?
You know, the thing I hear is we called the ambulance for my mom and it took forever. I mean, what is the expectation if you live 5 miles out of Pine City?
I think it would depend on the time of day. I mean, I would hope that you can get a response in under 15 minutes normally for most areas. I always would hope quicker, but there is the overlapping call needs. And then some of our biggest utilizers of frequent calls of low need are in Pine City. So if we have a crew standing by at the jail for a discharge and there's a cardiac arrest in town, the crew's coming from Hinckley. If a clinic's transferring somebody, we can't just put that on hold. We have to go do that call. It's considered a 911 response. So then that next call that comes in the area is getting the truck from the next town over, which is why when we have those extended periods of times, that's why we're moving our trucks down. But it is unfortunately somewhat of a dice shuffle some days. I believe statute's 30 minutes. I don't think 30 minutes would be the appropriate answer for the average though. I think that should be the anomaly. Any call over 30-minute response we review to figure out what went wrong. If was that a staffing issue for the day? Was it a direction issue? Could we have moved our crew's response? Do we have 2 responses going on at once, or one crew could have went to a call that was a little bit longer than their initial call, but the other crew could have cut that response time down. So we do review each one of those.
So I had heard, like way out by the Wisconsin border that it takes a long time. We've talked about this one before. Has that improved?
I would say there's been an improvement. I did take out just the first time. We did 3 trials of staffing patterns last year of work. We put trucks. Our east side of Pine County did see a slight decrease, like a 1.5 minute decrease. But when you figure the average time out there, it's kind of hard to get true good trial numbers in 6-week trials though, because if I have one person that falls down frequently, a lot in one town that's far out, it can skew my number greatly.
Yeah.
Example, during one of my trials, one of the towns that's in the middle of 2 other towns had a longer response time than the one that was south of it and north of it. But when I look back, it's because one person had multiple lift assists in a short period of time, so that skews that number pretty quick.
Madam Chair.
Yeah.
So how often do you think you sit with one rig in a county?
I don't know. With our new AVL system, we did build a geo fence around that area to track how often our crew's sitting there. So I don't know. It's not an uncommon thing that happens. It's an uncommon thing that happens for a lengthy period of time though.
So then if, let's say you have one rig
Mhm.
and they get a call and then they have to do a transport and they end up going out, how do you backfill that while they're gone?
So if we use our last out crew on a 911 call, are we saying? So our last out crew, while they're out, then we'd use mutual aid partners for the area. So in this area here, if it's the south part of the county, we would be calling Lakes Region. If it's on the eastern north part of Pine County, we use a lot of times Wellia. And if it's on the far north by Moose Lake, we'll use Carlton Ambulance.
So there's a good mutual aid.
Yeah, we actually have a mutual aid agreement with one neighboring service where if each other calls and asks for it, we'll actually move a truck over to our service area lines. Although I'll be honest, from both parties' side, I feel like we respond to their area just as much from our base as we do from that staging location. I'm sure they have the same experience. So there's some logistics behind that kind of make it harder.
Madam Chair, just to clarify, Matt had asked the question if you had one rig and did a transport, and you answered the question if you had one rig and did a 911
Okay.
response. Maybe you can.
Okay, so for a transport, like a hospital transport, we talking? We will not do a hospital transport unless we have 3 trucks available currently. If that crew, when we have 3 trucks available, is driving to Sandstone to bring someone to Duluth and another crew gets an 911 call, they'll actually pen that transport and stage there until that crew level gets back. Which some days, depending on call volume, it can be a real challenge, especially when you just need to bring someone across the parking lot back to a nursing home and it's tying up an ER bed. You're like, we could do this 4 minutes and be done. But we need to have 3 trucks available as our system standard to do a transport. We try to, when we have 3 trucks, that third one, we try to only utilize them for the local area hospitals for those transports.
Thank you.
Yes.
Any more questions?
Thank you very much.
Yes, thank you guys.
Thank you so much. And thank you for all the extra stuff that you've started doing. You know, it's just.
Tried to, I know the sheriff's office, thank you guys are doing a recognition program too. That's been a huge motivator for our staff. We don't give out $6, $10 gifts for people's anniversaries, no more, we give them points and my staff just bought a router, so like things like that, like make it a little more worthwhile, doesn't cost anything more, but it's much more meaningful, I think.
Nice. Thank you. So we're going to move on to Arrowhead Counties Association legislative priorities.
And Madam Chair, this, the Arrowhead meeting is tomorrow and Matt, I presume you'll be up there. But this discussion is just if there's any thoughts on what we would want Arrowhead to work on. And so in your packet were last year's priorities. And then I did go and look at what the District 1 AMC priorities were from the October 10th meeting, just to see if there's crossover. And on the number 1, the tax forfeiture issues arising out of the Supreme Court ruling, the cleanup, I think, is going to become a more pressing issue. And we know we have that old creamery in Finlayson, right, that we're struggling with funding on. And so if the board were interested, that might be a good priority for AMC because many of the AMC counties have those same types of high cost tax forfeit properties. The support for EMS, it coincided real well with AJ's presentation, but EMS support was the number 1 District 1 priority. And then on the third one, mental health, high acuity beds for youth and adults. The mental health came out as tied for number 2 at the AMC District 1. And so a lot of these that Arrowhead is working on are district priorities. So I don't know if that is helpful as you think about what direction you might want to give Matt as he goes to the meeting, but I just wanted to.
Well, number 5 too, the casino collection of local optional sales tax. That's been something that we've talked about here since I've been on the board. So that's a big one too for us. And I know it is for Carlton County too.
And just an editorial on that, it isn't going to change the amount that we collect, right? So when I scratch my head and say, how important is it? It seems like there's a low return because if they start collecting the tax and we reach our threshold a year earlier, that would be beneficial to the extent that you could potentially adopt a new road program, add additional roads and, re-adopt the sales tax. But it isn't going to change the amount collected. So just something to weigh and balance with that. It's not, it may not be as pressing, I guess is what I'm saying, as some of the other needs because you've adopted a very long-term road program.
Well, the mental health beds is huge because we just don't have them. We've had kids that have gone to Fargo to get mental health, families shouldn't be separated with having their kids in Fargo when they're here in we need beds.
And then the availability, what happens if if they don't have the beds,
Right.
they say, well, take them out and they get stuck there. We get that bill at that rate.
Right.
Because they release it, but we don't have a place to put them.
Right.
So if they're if they're in emergency care and once they reach level of care change or whatever, where they can be managed somewhere else, the state stops paying that bill. And that's where we've been trapped with big bills in the past.
Right.
When there's not a bed out there. So I don't know how, that's a big fix.
It is a big
That's
fix.
gonna be,
It's bigger since they closed a lot of the beds down, so yeah. Anybody else have any thoughts for Matt for tomorrow?
thanks, that just helps. I got it. I wrote down the ones we have. I think the top three are important and they're gonna have their priorities separate from ours because of the Iron Range and the shoulder blade. And I'm not sure if I'm gonna make it right now, but hopefully I can maybe Zoom and I'll see if maybe JJ, somebody can Zoom in if I can.
Okay,
But, cause I wanna get ours at least mentioned to them and I can always email them to Barb too, but it's better if we do it in person,
sounds good. Extension committee appointment.
You want me to take it? Since I guess it's mine. Yeah, we had Tracy, LeBrun was appointed and she is unable to continue her member. So we have a kind of a midterm vacancy. Kurt Mangan is, someone that I reached out to. I know him. He works for Phase. He's the chief operation officer there. He's got 5 kids or 6. I kind of lost count after a while, but I've known him for a while and he'll give me crap for that, but that's fine. But we've had kids the same age and he's just a great guy. A lot of his kids are in 4-H. I think his oldest was the summer intern this year for 4-H. So he's heavily involved. And one of the nice things I appreciated about it is he asked for a lot of information before he made his decision. So he talked to a few different people. So it's kind of it was a pretty good educated decision, I think. So, so with that, I will make a motion to appoint Kurt.
I'll second it.
Thanks, Josh. Got a motion by Josh, second by JJ. Are there any questions? All those in favor say aye.
Aye.
Opposed? Motion carried. 2025-2026 Lower St. Croix Watershed Partnership.
Madam Chair, members of the board.
Hi, Mike.
Hi. So Pine County is a partner to the Lower St. Croix Watershed, and every 2 years they submit their biennial plan, and those plans must be approved by 10 of the 15 members of the partnership. This work plan includes $2.6 million of expenditures, which will go for water quality and ecological programs. And again, the Lower St. Croix is a watershed that includes Washington County, a little bit of a Ramsey County, a little bit of Isanti County, and a lot of Chisago County. So it's a very small portion of Pine County, but it's still going to benefit the county.
So are there any, go ahead, Steve.
No, I was just gonna make a motion to
Perfect.
approve it.
All right, motion by Steve.
I'll second.
Thanks, Josh. Second by Josh. Are there any questions on this?
I will say that I've been so impressed with that group. I think there were a lot of people in the state that thought this watershed couldn't work because it, a mixture of rural and urban, people and projects. And I think we've proved them wrong. And we've been very, good about, sharing and caring about, the whole watershed from the Rock Lake all the way, to the Lake St. Croix on the in Stillwater. So
Thank you. So we have a motion by Steve, a second by Josh. All those in favor?
Aye.
Opposed? Motion carried. Nemadji watershed.
Sure. And again, Madam Chair, members of the board.
Yeah,
Mike
Mike,
Ridley,
that's good.
Human Resources Manager. Again, this is, they were just looking to expend about $469,000. The Nemadji covers a little bit of north eastern Pine County and a bit of Carleton County. Carleton County takes the lead on this one. So they've requested that we approve this budget.
All right. Did you have something you wanted to add, Matt?
No, I was just gonna say, I reported on this our last board meeting, and then when we set the new biennium budget. And I explained how it was in all the groups, the forestry, the, groundwater and all that. So this is that product. And I didn't send the whole thing because it's down, but anyway, I will move that, Madam
Thank
Chair.
you. Motion by Matt. Is there a second?
I'll second it.
Thanks, Steve. Are there any questions on this? All those in favor say aye.
Aye.
Opposed? Motion carried.
Thank you.
Powers agree. Thank you, Mike. Joint powers agreement with Hennepin County onboarding inmates. Hi, Rod.
Madam Chair, members of the board, Hennepin County has contacted us and asked if we'd go enter into a joint powers agreement for boarding of their inmates. While on the surface, I said yes, we would do what we can to help them out, our neighboring counties. We would be in a limited capacity. This isn't for guaranteed beds where they can just ship people. If we guaranteed 20 and they would ship up to 20. But we did commit to, we would take on 5 to 10 females at this point. Females being the largest area that we have for availability in our facility. But it will be based on our needs first. Should we have a higher capacity, and that capacity is going to be 25 females. If we were to go higher than that, we would have to send some back. They just require a 24-hour notice, and they'll move inmates within 72 hours, I believe. Contract should be before you. We'd be looking at $55 a day, plus they'll cover all medical costs, dental costs, and prescriptions, and they'll take care of all the transportations back and forth. So I'm requesting that we approve the joint powers agreement between Hennepin County and Pine County Jail, pending the Pine County attorney approval. And I put that in there because there was one piece of language that Reese wished to have added in the event of disputing an invoice that we would send. We just want to make sure that it was clear. It was minor language, but I think it was important. So we're just waiting for that to come forward. With agreement by the board, we were authorized, I'm asking to authorize the board chair and the county commissioner to sign the joint powers agreement. Financial impact is a potential revenue generated at about $55 a day per inmate. I just put that in there because I don't know where it would end up, but if we can average 5, that's $100,000 revenue impact to our facility. That does not add cost to our operation now. It just offsets what we're already paying. And should we be able to increase that number, we would offset again. We're looking at about a 1 year with them for right now. Hennepin County has a cap. I don't know if you've read in the news, but they're out there having to they're mandated by the state November 14th to push out 200 inmates. And when I talked to their captain, they're looking at more like 300 to the state for reasons for the lack of their facility and for staffing. Because of the lack of the facility, their staffing ratios had to go down. And for the staffing ratios go down, they don't have enough people. So therefore, they're pushing out to the neighboring counties. So any questions?
Yes, duration, how long?
About a year for now, but they may want to enter into something longer term as well. We just review it every year. And it doesn't mean we're in it for a year or two. We have a 24-hour out clause if we needed to reduce the population.
Thanks, Ron.
My question, Madam Chair.
Mhm.
Um,
Go ahead.
Transportation then is included? They'll take care of the moving the,
Yes, they'll take care of bringing people up and back as we need, you know. We will accommodate Zoom court hearings as needed. We have the capability and so we'll be able to accommodate that.
thank you.
Makes things real easy. Yep.
Go ahead.
Two things. I was kind of curious because that's a little low on the reimbursement rate, isn't it? Or what is it? But
$55,
Yeah,
that's
or
an
is-
average through the state.
Is it? Okay.
State the state employee or the state prisons have upped theirs to $60, you know, but overriding, you know, we set our own rate and our rate is $55 through the county and that stays consistent with all the surrounding. You run in the risk of you start negotiating lower rates because you want more people and then things go all over the board. So 55 is a good number.
Okay, and they were covering some other stuff, so I just figured that. But the other thing I just want to make a notion about is the reason they're in this position is because they didn't have it's kind of like what we're looking at down with your jail rate. I mean, it is, but it ain't, but
Right.
unfortunately, we're gonna come to a point where we might have to make some hard decisions and spend some money. Otherwise, we could be potentially put in this situation.
It'd be tough for me to speak on what their needs are, only because I know they're an older facility. But the DOC and the way they're managing their 2911 and they're pushing out these mandated changes are affecting jails throughout the state. And Hennepin being a large facility, it affects them a lot more than it's affecting us right now. And so we're gonna see that kind of stuff happen.
And I know you've just done some pretty substantial changes down there to accommodate females a little bit better.
Correct.
So I appreciate it. I guess what I'm saying is you're putting us in a position that you could accept some inmates because of some planning and stuff that you're doing. So I look at that as I thank you because it's good. So
Trying to think out of the box all the time and they're not a money-making venture, but we can also always look for ways to reduce costs or at least offset costs. And that's what we work at every day.
Thank you. Dave?
And Madam Chair, and appreciate Josh, you kind of bringing up the question. But I know sometimes it's asked, you know, DOC requires this, that, or the other thing, and what happens if we don't do that? And I think Hennepin County is in the position of having to respond to some directives from DOC. And that's not a comfortable place because then you're scrambling. And I think as Rod is, you know, able to explain, it's a little bit of a dance, right, with DOC, that they're constantly evolving and they sometimes change their interpretation of the rules. Sometimes there's a new rule, sometimes there's a new inspector. But it's a very dynamic situation.
I agree.
Madam Chair,
Yes.
I will move this pending Pine County Attorney approval of the issue with the invoicing.
Sounds
Or
good.
move it, not approve it, move it.
Thank you, Matt. Do we have a second?
I'll second.
Thanks, Josh. Motion by Matt, second by Josh. Are there any questions? All those in favor say aye.
Aye.
Opposed? Motion carried.
Thank you.
Well, this is not on our agenda, but a ways back, Kelly Schroeder worked very hard on getting our forfeitures and everything taken care of with the Association of Minnesota Counties after the Tyler versus Hennepin. And so they actually have an award for you. Thanks, Rod. So, and this is so fun because being the district director, I get to give it to you. So the Association of Minnesota Counties say, let it be known that Kelly Schroeder is granted the degree of, I like this one, Honorary Doctor of Philosophy, PhD in tax forfeited studies. And so, thank you. You worked so hard on that and it's so appreciated. And I don't think if you would have worked that we would have gotten the benefits that we did get, which is having the state take over those payments. And I'm dealing with a lot of the stuff that we would have had to have dealt with. So, not only does AMC thank you, but we in Pine County thank you.
Well, thank you.
They made her sit through the whole meeting so we could do that. No. So commissioner updates. We've got the Snake River Watershed Management Board. It's dissolved. Whoop, whoop. If I had fireworks that I could blow off, I would do that. But that is done. They're still gonna work through, we've got to have the audit done and we need to do the just figure out the final expenses so that we can get our money back from that committee, but
Is
it's.
there a rough estimate at all?
40 something.
I want to say it was like 45-ish. And their goal is to have all of the payments, all of their bills paid and all of the refunds to the counties made before the end of 2024. So that as of 12/31/2024, they have zero money. And then the audit will be done starting in January 2025, showing they have no money and then giving presumably a clean bill of health to close out.
All right, thank you.
It was kind of funny. There was still somebody that doesn't feel that we should. So you know, it's kind of crazy how you still have the people that think that we need to continue the old way, right? But it was good. It was a celebration day.
Madam Chair.
Yeah.
And I would just like to point it out. I think we are in the One Watershed, One Plan and everyone in this county, right? We're in
Yes.
agreement, we're rolling, we're good to go. This was one of the only ones, and it wasn't a One Watershed, One Plan, but it was one of the only water type of deals we were in that we actually paid money into. So that now, I mean, we just passed a grant, or that one we just did was what, $2.5 million. That's all, that was competitive grants before. Now they're guaranteed, or they, not guaranteed, they put a plan, it's approved, and they have this money to spend. I was on Snake River Watershed Management Board way back when. There was times we didn't have a grant for years at a time. We did nothing other than give them money every year to, I don't know, think about things and yeah. So and that's when I went over there to lobby or to,
Right.
I was like, what are you, but they just got whatever, that's how they feel. So I don't know. I think it's a big win. So.
You know, it was interesting. Two of the members on that committee and out of four, so 2 out of 4 were the ones that were on that when it was initially put forward, you know, and they didn't want to give it up, which, you know, we're running into the same thing with the SSIS. The person that runs the SSIS department is the one that created SSIS, and he's saying it's fine. It doesn't need any improvements. So to get the people that are proactive and want to move things forward is big. So having this dissolved was big.
And I've thought of another thing, when they wouldn't dissolve it, we just asked to be removed and they wouldn't allow us.
Well, they would let us, but they wouldn't give us our money back.
So
Yeah,
that's
they wanted
another
to
one of
keep
them.
using our money. Yeah,
So.
yeah. Labor negotiations.
We are negotiating and we have well, we're in the back and forth. And November 22nd, we're back at the table.
Okay, thank you. Essential Solid Waste Commission.
We met last Monday. You know, they're still trying to finish up the, new cell.
Okay.
They have not got the liner down yet. The liner company, I don't know if they got it done before this rain, but it's a tough project to do. You can imagine trying to spread out plastic liner over several acres in wind. You can't do it in a windy day. What have we had in the last week? Wind.
Yeah.
Can't do it in a rainy day. What have we had the last few days? Rain. So you know, we'll be all right. One thing we are
Let me think.
bumping up against is the leachate. That's the water that's in the landfill. And of course, I don't know how much it rained last night over there. It rained 2 inches. You get 2 inches of rain on 7 acres, that's a lot of water. And if every drop of water that seeps into the landfill becomes leachate, then it has to be treated. And then we have to truck it out. We've got 1 tanker truck, 1 driver, and he makes about 3 round trips a day. And we're getting behind, so we're gonna have to hire a company we have in the past, and it'll probably take.
They have a drain field set up underneath it, then they can pump it out.
Yeah, it pumps out, it goes into a settling pond, and then, we're gonna have to figure out how to, treat some of that locally. And it's because it's got this forever chemical in it, the PFAS. So now you gotta have a better treatment deal. I think what it's coming down to is we will, basically it'll be a giant reverse osmosis machine. So we'll suck the contaminants out, haul them to Pig's Eye to get treated and then pump the water, land apply the water that's left. Anyway, that's where we're at.
Thanks for all you do on that committee, Steve. East Central Regional Library, there was no meeting. However, yesterday we did have a planning meeting. And so they just finished their strategic planning and we got the plan all set and that'll be presented at the next library meeting. So that was yesterday. Cross that off. County canvas.
I can take that.
All right,
All of our numbers worked out. So
perfect,
accurate. Yep.
perfect.
I wanna add to that,
Mhm.
because it was a long day. I don't know how many hours we sat here.
What's
but you have to go through every vote in every precinct, everything from the county election on up through the presidential election. And I want to thank Kelly and bring this back to your staff for the wonderful work they do. It's a tough goal for them, and it's not just election day anymore.
Mhm.
We started early voting 6 weeks ago, 7 weeks ago. And so if you were ever in here during the last couple weeks, for sure, and early voting, it was a steady stream. There was 150 people a day coming in here, and somebody has to take care of them and explain,
Yep.
you know, in a kind voice, the same thing to the 150th person as they did to the first person. And so it was a long process.
Madam Chair.
I will add that it was 4.5 hours straight, no breaks.
Yeah.
She's a slave driver.
Yes.
Yeah.
We timed it when it wasn't our turn. If we had to go.
Josh, were you gonna say something?
It was fun. It was really fun. We all wanted to get it done anyways.
I would just like to add that I did early vote this year and it takes substantially longer. It isn't just walking in, showing your ID or whatever at the polling place. And which depending on, I might not do it anymore, but it worked out this year with my son to get it done. But like you said, 150 people, it's way different at the polling place. You know, you can pretty much rip in, rip out, at least at my polling place. Where here there's a lot of explanation, a lot of stuff that has to go on and different stages to do it. So it takes a lot more too, I guess is what I'm saying. So
Mhm.
I appreciate it.
All right. Soil and water.
Yeah, they don't use Zoom, they use the Microsoft version. It crashed on me, so had a little lapse. But what I do have to offer is some constituents have brought up to me again, there's a property up in our area that's within the floodplain and it is within the footage restriction of the river, Kettle River. And they're starting to take apart vehicles and transmissions and engines and there's fluids evident leaking into the ground.
Mhm.
So we talked about that a little briefly again there. They were hopeful to work with probably with Mike before he leaves or the new gentleman now that's taken over and try to get a plan on that. And then some wage increases they voted in at the soil and water. And as soon as the draft minutes are ready, if anybody wanted to look at them, I can forward them to you. If they don't include you on the list, that's all I got.
Thank you.
You're welcome.
Pine County Education Leadership Network. Do you want to go with that one?
Yeah.
Steve, or should I?
Right, that would, I think was last Wednesday.
Mhm.
Anyway, we met at the Pine Tech new rec center, and went over, actually, tell me the guy's name again.
Luke Reiner.
Luke Reiner, who we've heard before, some of us, went over some statistical information about Pine County. it's pretty interesting stuff about how many people, the job market, and we're doing way better than an average outstate county in Minnesota is doing in some areas. And some areas we've typically always had more unemployment than other areas. And, you know, we rely a lot on service sector jobs. And when the service sector got a huge hit 3 years ago, it's taken a long time to build that back up. And, but it's coming. It's all.
How's their enrollment, Steve? At the,
Oh, Pine Tech, we didn't spend a lot of time talking about Pine Tech, but I believe Pine Tech is right there within 1 or 2 students, I think, of a record year. So they're doing well. Their new addition is coming along on schedule. And so once they get that done, then they will go back and start moving programs out of existing places and doing remodeling there. It's kind of it's like remodeling your house. You move into the new kitchen and then you tear the old kitchen out, and you know, they got a lot of that to do once they get this part done.
thank you.
So we met in the rec center. So, and there was all it's active there. There's a lot of things happening. So trying to hear what was going on was really difficult because there was so much noise and so many kids that were utilizing it. There was like a game night where they go in and play board games. And then I think they had a tour, I think Joe said. So there's a lot of stuff happening there. And he said, that he's really surprised at how many kids come and utilize that rec center with it being so new, and board night is a huge thing where they can just go play board games. So it was fun. It was fun being there. One watershed, one plan for Kettle River.
There was no meeting.
The meeting, okay. Mille Lacs Corporate Ventures.
We met Friday and got a little bit of an update on the facility in Hinckley that they've just started, basically gotten it, and they'll get that remodeled, the old Toby's Mill, I think it was called. We met, Dustin has left that arena and took another job, so we got a new person in his place, so we met him just briefly. What was his name again? Jake?
Jake, right? Jake?
Not Jake from State Farm, but.
No.
Anyway.
And he came, was it from White Earth that he came from? Or was
Red
it Red
Lake.
Lake?
Red
Red Lake. Okay. Yeah. So I think good things are going to continue to happen there. Extension Committee.
I didn't make it. David, did you make it or not?
I did not.
Yeah, okay. I have not heard, sorry.
Chemical Health Coalition. I was late because we were actually doing a meeting, which is where David was, on cannabis. So the thing that because I was late, the thing that I really liked was, I just lost his name. The superintendent for Willow River and Barnum, Bill Peel. He had said that they do not allow cell phones in their school anymore. And so you have to turn them in and then you can pick them up at the end of the day. And he said the vaping has gone down. People are spending more time in the gym. They have open gym during lunch. And he said there used to be maybe 3 people in there, 3 kids, and now it's full with people doing the activities and playing. There's more people talking to each other, you know, just all the high points of that. I asked him if he shared that with the other schools, because I think that's having our cell phones and having their cell phones at their desks is, it's just too much of a distraction. And so he said he hasn't shared it with any other schools yet, but I thought that was just a really amazing thing that they're doing there. Department of Children, Youth and Families, ICWA quarterly meeting. That was yesterday morning, and that was meeting with Tiki Brown, the commissioner was there from Department of Youth and Children. And then Becky Foss was on the call, and then it was tribal leaders. It was nice hearing Virgil Wynn was on the call and having him ask a lot of questions, and being active, trying to learn and grow. We did talk about the fact that it was a Zoom meeting, and one of the big things is they want to do relation building, and you don't do relation buildings with Zoom. So I don't think they're going to be doing Zoom anymore. But it was interesting. They gave a really good round on what ICWA is and how it's processed, and the whole way that the program for ICWA works, and how they go out and they do their challenges, or they do the checking to make sure that we're doing all of the things that we need to do and dotting our i's and crossing our t's. So it was good to hear all of that and for everybody to kind of be in the same page with that. Yeah, it's a good meeting, a good committee. I hope it continues to flourish, because the relationships between the tribes and the counties, I think, is big if we're going to continue to grow and do better. Lakes and Pines.
Yes, we met yesterday. It was mostly admin because we'd have a new chairman who is from Pine County, Tim Burkhart from Hinkley. And so, along with that, we had, several new appointees to the board, and so getting committee within like two times, established was pretty much what this was going to be.
Are there others?
Central, Minnesota Council on Aging.
So do you know which?
We ready for that?
Yep, go ahead.
Okay. We met, last week, and, one of the big things is the coming year, is a big funding concern, because the amount of money that's available for things like, Meals on Wheels, we call it, is actually less than it has been, and the cost per meal is going up. So you know what that means. It's just gonna be probably less meals provided. Catholic Charities and Lutheran Social Services are the two big contractors for central Minnesota. We have Catholic Charities in Pine County, and they have, they have other sources of funding, but limited because of their benevolent givers. So they're gonna, and they keep consolidating kitchens and preparing more frozen meals, and so they think they'll be able to provide the amount of meals that are needed, but it's getting to be a struggle for them. There's about $4.9 million worth of requests, and they have 3.8 million in funds. So,
Wow, that's a big difference. It's a big difference. Anybody else have any others? All right, so I went to the governor's listening session up at Osprey Wilds. There was no governor and there was no lieutenant governor, so it ended up being the Minnesota Department of Revenue talking about deer hunting and what we can do to get more people to deer hunt and what we see as issues with deer hunting. So I was able to bring up delisting the wolves again. So we'll see where it was, but it was, I want to say, an hour and a half or 2 hours of just talking about the deer population and deer hunting in general and how to get more youth to hunt and fish and that type of stuff. So it ended up being kind of interesting, actually. Rural Action Caucus, which is through NACO. And the one thing that they did talk about, a lot of it was on disaster. So with flooding and that type of stuff. But there's the lame duck session that's going on with the federal government right now. And they're looking at spotlighting secure rural schools. So it's the Senate already passed it and they're waiting for the Congress to pass it to see if they will. And it's where rural schools can get some money. There's quite a bit of money out there. But the gentleman that was talking about it, everything froze. And so he wasn't able to keep it going. And so we did get it emailed to us and we had talked about it at the school meeting that night. And then Dave passed that on to the schools to see if that's something that we can get some money on in our school districts. We had a meeting with cannabis zoning. cannabis is coming and we came up with something that I think will work. Would you agree with that?
See,
So it's coming soon. I think that by the end of the year. So hopefully, there's a couple other people that are going to work on writing the resolution to take some of that off of Kelly because she's pretty crazy right now with things going on. So that will be coming hopefully within a couple weeks to see where that's at. And so we can get that passed before the first of the year. And then we have a great group in our county and it's a community restorative justice program that they're doing. And so I'm just trying to figure out what to do. There's a grant that's being applied for and then getting the committee together so that we can start doing restorative justice in our county. So keep supporting Reese and Terry and the other people working on that. It's a good program. And that is about it. Once again, anybody else? All right, meeting adjourned. Have a great